Hi everyone, it's September 22nd, 2008. Terry Finley here. I wanted to take a moment to update everyone on Saratoga Russell. Obviously, we've all been frustrated with our progress with his throat. I saw him last week in Kentucky. He looks very good. They took the stitches out, and what we've done is we actually took a videotape of Dr. Baker, and as soon as I'm finished, we'll move to him. Shannon Castanola took the video of him at the sale last week and talking about Saratoga Russell. So we're guardedly optimistic that we're going to get him back. We never know how that throat's going to hold up, but as I say, we're staying on top of it, and I appreciate everybody's patience with this colt. We know he has a really good bit of talent, and if we keep him together and we keep that throat as good as we can get it, I think we'll have some fun with him at the end of this year and on into 2009. So without further ado, I'd like to introduce a video of Dr. Baker talking about Saratoga Russell's throat. Thank you.
And as people may or may not know that are watching this video, throat is a dynamic situation that changes with every breath and with every swallow, and with infection and allergies and on and on and on. So when he was first presented to me about 2 or 3 months ago, he was dorsally displacing his soft palate and commonly called, commonly called flipping his palate. That means his epiglottis was riding above the palate itself, and when a horse does that, he breathes through his mouth, and when he breathes through his mouth, the palate flutters, the horse gets scared, and also he can't get enough air. So that was his primary problem. Also, he had probably about a 50% paralyzed vocal fold on the left side, or a retinoid was not functioning properly, the retinoid cartilage of the larynx. So it was decided in talking to everybody that to go ahead and treat this horse for the infection of the guttural pouch, which he also had. So we treated him extensively for the guttural pouch infection. The nerve that supplies the palate actually goes through the guttural pouch, and it can get inflamed sometime from the infection. So we did that for a series of treatments, got the guttural pouch infection cleared up, and the the dorsal displacement was still there. Obviously, the slight paralysis of the left retinoid was still there. So we had to make a decision as to what to do. In order to do a tie back, which opens up the airway, we have to have those horses completely paralyzed. This horse is not completely paralyzed. And we had to figure out a way to keep him from dorsally displacing his soft palate. We cleaned out the infection. That didn't do it. So we decided to go ahead and do a ventriculectomy and to give him some significant airway. We did that. That helps get airway where the retinoid is dysfunction. So we did the ventriculectomy, got him a little more airway. We still dorsally displaced him. We let that heal up. Now, and just 2 weeks ago, or a week ago, I think, we did a tie forward on him. And what the tie forward does is interlock the epiglottis with the soft palate to keep the soft palate from flipping. So it's a try and see situation on a lot of these horses that have airway disease, and that's what we're doing with this horse, is we're progressively treating what's presented to us and confronted it with surgery and or medication. So now what we've done in the course of this is we've treated him extensively for the guttural pouch infection. We have that under control. We've done a ventriculectomy, which opens his airway up. Not 100%, but he's probably 80% open now, and we feel like that enough to give him adequate air for a short race, like a 5.5, 6 furlong race. And then also we've addressed the palate problem, the flipping of the palate, or a dorsal displacement of the of the soft palate, if you will, by doing a tie forward. So in what stage we're in at this point is that he's recovering from that surgery, and he's about 2 weeks away, 2 to 3 weeks away from going to the track, and it's just a try and see situation.
So you won't know that if it's worked or if it's successful until he gets to the track?
Exactly. I can scope him, and I have scoped him post-surgically, and it looks good. But as I said in the previous statement about throats, they're dynamic. And they're dynamic in the fact that the horse has got to take in the air to perform. In order to perform, the throat's got to work, and it changes, the dynamics of the throat changes with every breath. So it's a try and see situation on those things.
So, and just to put it real concisely, the horse came in with multiple issues. You've treated each one individually. Is that correct?
That's right.
Okay.
Yeah. And it was a progression. First we cleared up the infection.
Right.
And then we did the ventriculectomy. And then we healed up that. Then he got another guttural pouch infection. Cleared that up. And then we did the tie forward.